Dr. Sarah Ortiz was saving the life of a famous billionaire when she realized someone in her own surgical team was trying to kill him. With her blonde hair hidden beneath a surgical cap, her blue eyes caught the deadly movement too late. The operation had been scheduled with the utmost secrecy. Marcus Blackstone, tech mogul worth $47 billion, needed emergency surgery to remove a blood clot from his brain. Only Sarah's elite surgical team knew about the procedure, hand-picked professionals she'd worked with for years. But someone wanted Marcus Blackstone dead. Dr. Sarah Ortiz stood over the billionaire's exposed skull, her steady hands guiding delicate instruments through neural tissue worth more than most countries' GDP. Blackstone's latest invention, a revolutionary AI chip that could decode human thoughts, had made him countless enemies in both the tech world and international intelligence communities. "Vitals are stable," announced Dr. Kim Patel, her trusted anesthesiologist. "Blood pressure 120/80, heart rate steady at 68. Sarah nodded, her piercing blue eyes focused on the surgical field. The clot was larger than anticipated, wrapped around critical blood vessels like a spider's web. One wrong move could leave the genius tech innovator brain dead, or worse, kill him instantly. "Microforceps," Sarah requested, extending her hand without looking away from the patient. Nurse Rebecca Chen, who'd assisted Sarah in over 200 surgeries, placed the instrument precisely in her palm. The team moved like a choreographed dance, each member anticipating the next move. But Sarah had no idea the dance had become deadly. 3 hours into the procedure, something felt wrong. Blackstone's blood pressure began fluctuating in patterns that didn't match the surgery's progression. Sarah paused, studying the monitors with growing concern. "Kim, are you seeing this blood pressure variance?" Dr. Patel frowned at his screens. "That's unusual. His vitals were perfect a moment ago." Sarah's instincts, honed by years of life-and-death decisions, screamed danger. She'd performed this type of surgery dozens of times. The patient's body was responding in ways that didn't make sense. "Check his IV line," she ordered, her voice carrying new urgency. As Dr. Patel moved toward the IV stand, Sarah caught a glimpse of movement in her peripheral vision. Nurse Chen was slowly withdrawing a syringe from the secondary IV port, a syringe that wasn't part of the surgical protocol. Time slowed to a crawl. Sarah's blue eyes met Chen's shocked gaze as the nurse realized she'd been spotted. For a split second, both women froze, understanding passing between them like electricity. Rebecca Chen, the woman Sarah had trusted with countless lives, was trying to murder Marcus Blackstone. The next 60 seconds would determine who lived and who died. "Security!" Sarah shouted, but Chen was already moving. The assassin disguised as a nurse lunged toward the surgical table, a second syringe appearing in her hand like magic. Sarah threw herself between Chen and the unconscious billionaire, her surgical training transforming into combat instincts she didn't know she possessed. The two women crashed into the instrument tray, sending scalpels and clamps clattering across the sterile floor. "Dr. Ortiz!" Dr. Patel screamed, but he was trapped behind the anesthesia machine, unable to help. Chen was stronger than Sarah had imagined, her nurse's gentle demeanor replaced by the cold efficiency of a trained killer. She pressed the syringe toward Sarah's neck, the needle gleaming under the harsh surgical lights. "Nothing personal, Doctor," Chen hissed through gritted teeth, "but Blackstone's AI research threatens too many people. He has to die." Sarah's blonde hair spilled from beneath her surgical cap as she fought for her life and her patience. Her blue eyes blazed with determination as she grabbed Chen's wrist, using the assassin's momentum to slam her hand against the steel surgical table. The syringe shattered, its contents, likely potassium chloride or another cardiac toxin, spilling harmlessly onto the floor. Hospital security burst through the doors just as Sarah managed to pin Chen's arms behind her back, both women breathing heavily from their life-or-death struggle. "Rebecca Chen, you're under arrest for attempted murder," the lead security officer announced, handcuffing the nurse who had fooled everyone. As Chen was dragged away, she looked back at Sarah with eyes full of professional respect. "You should have let him die, doctor. You have no idea what his technology will do to the world." But Sarah's job was saving lives, not playing judge and jury. 2 hours later, with a replacement surgical team, Sarah successfully completed Marcus Blackstone's surgery. The blood clot was removed without complications, and the billionaire would make a full recovery, never knowing how close he'd come to assassination on the operating table. Later, as Sarah sat in her office reviewing security footage, she discovered the chilling truth. Chen had been systematically poisoning Blackstone throughout the surgery with microdoses designed to mimic surgical complications. If Sarah hadn't caught that final injection, it would have looked like the patient died from the stress of brain surgery. The FBI investigation revealed that Chen was part of an international conspiracy to eliminate tech leaders whose innovations threatened global power structures. Sarah's quick thinking had not only saved Blackstone's life but exposed a network of medical assassins operating in hospitals worldwide. Dr. Sarah Ortiz, the risk-taking surgeon with piercing blue eyes and unshakable courage, had faced her most unusual challenge yet, not just saving a life, but protecting it from those sworn to heal. The blonde doctor who had always pushed medical boundaries had learned that sometimes the greatest threats come from those closest to you. Sarah Ortiz's battle against a medical assassin proves that heroism comes in many forms. Her story reminds us that sometimes protecting life means fighting for it in ways we never expected, even against those we trust most. If Dr. Sarah Ortiz's Surgical Room Showdown captivated you, subscribe to the Frontline Voice for more medical thrillers. Hit like if you believe doctors should protect their patients from all threats, not just disease. Tell us in the comments, how would you have handled discovering a killer in your surgical team? Share Sarah's story with someone who appreciates heroes who fight for life in every form. Until next time, remember that the greatest battles for life sometimes happen in the most unexpected places.